Okay, this video is an update on the status of my cancer treatment. I'm going to start with a CT scan that shows what the disease looks like upon presentation 2 years ago. This is metastatic GIST cancer. GIST stands for gastrointestinal stromal tumors. And this was in January of 2010, and it's showing tumors that have metastasized to the liver, which makes it inoperable. My primary tumor was at the junction of my esophagus and stomach, and it had also spread to my spine and pelvis, so it was pretty advanced before I knew I had it. Other than that, I was a healthy 43-year-old. That scan showed vertical slices front to back. This also has vertical slices side to side, so this is coming in from my liver side, going through the liver from the side in a vertical manner. The scan report said that tumors were too numerous to count, so you can see that there's quite a bit of activity there. I've been on quarterly scans since then, so I've had 9 now. Most of the scans look like this for the first 18 months, which shows pretty miraculous response to the targeted chemotherapy drug Gleevec, which is an oral therapy. And you can see how the tumors are dark with clearly defined edges, indicating that they're inactive and they don't have a blood supply. Size of the tumors also had shrunk about 50%. So go ahead and I'll play this through to show what it looks like on a video view here. So still a lot of tumors there, but again, they're dark and clearly defined. At the 18-month mark, my scan showed activity with new tumors and slight growth in existing ones, so my dose of Gleevec was doubled 800 milligrams. And then at 21 months, there was slow growth, relative stability, so there was no changes. But my scan last month, February of 2012, showed pretty widespread progression. Go ahead and play this through here. And at this point, I was switched to Sutent. So I've been on Sutent for about a month. So in this current scan, you can see that there's a mix of light and dark, and the tumors don't have a clearly defined edge. Also, there's growth in the tumors, so they're larger dimensionally. I don't know if these images showing widespread growth are typical of Gleevec-resistant GIST, or if normally there's just resistance in isolated tumors. But if you look at the 3 side by side, let's see if we can get a similar view here. And try to find a comparable. Yeah, so if you look at these side by side, you can see visually that the current scan is a lot more similar to the first scan upon diagnosis than it was when the tumors were stable. For those of you familiar with GIST, I'm mutation type exon 11. So statistically, Sutent has a median progression of about 44 weeks of effectiveness. And at the 1-year mark, 36% of exon 11 patients are progression-free. But if you have high blood pressure as a side effect, that increases to 63% are progression-free at 1 year. So I do have hypertension as a side effect, so I have that going for me. I've been pretty lucky that I've avoided most of the other side effects of Sutent. I've really just had hypertension along with mild fatigue. So as long as this is working and I keep my blood pressure under control, I'm doing pretty good. The next option when Sutent fails is there's some similar class drugs or combination therapies that are in clinical trial or available off-label. I'm optimistic that these will keep me around until a cure is found, but needless to say, sooner the better. Again, I'm just a patient, not a professional, so if there's anything inaccurate here, or if there's any questions, let me know. Feel free to give any comments or feedback to, there's my email address there. So that's it. Thanks.